We're back with another episode of Cherish Your Yoni, and today's topic is actually a very important one. This topic has increasingly been getting more and more coverage over the more recent years, but there's just so much to talk about and bring to light. The drastic difference in pregnancy and maternal health in the Black and Brown community versus our other counterparts are very shocking, and we just have to keep talking about it and talking about it and talking about it.
It's like implicit bias, right? Mm-hmm. Implicit bias is racism. We just want to water that word down. Yeah, everybody's biased, everybody's prejudiced, right? Right. So let's not say implicit bias, let's just call it prejudice, and let's call racism what it is instead of like trying to water it down. We know what racism is, right? It's not implicit bias.
Right.
So it's the same thing for me, like in terms of a doula. Mm-hmm. So I started in, I'd say 19, dating myself, but my son is 38. So somewhere around 1980, a group of sisters, we decided that we were going to study, right? Mm-hmm. Because we were coming together and sisters were having C-sections like 40 going north. Mm-hmm. And so we were like, we're going to study, we're going to learn this craft. And we were underground. We were illegal as you could possibly be.
Wow.
And so we were delivering babies, right. Word of mouth, underground. We were underground birthing peoples, Wow. And so, but we didn't just show up. I mean, we studied under doctors, we studied under midwives, so we could learn our craft. Right. We did everything that, a doctor, quote unquote, would do as it relates to birth. Because let's face it, we used to have babies in the hospital. Right. They discredited midwives for years and years and years, right? Yeah. And so, it was hard for sisters to actually be in the hospital and be treated fairly. So this whole, maternal and infant mortality is nothing new, right? So then, because we had delivered so many babies and we were like, we may get arrested. This may be, so we better stop this right now, Right. So we decided that life happened. So we went back and started doing other things, getting degrees and stuff like that. And then about 5 years ago, because the stats hadn't changed, we kind of still kind of tiptoed and did some births. Right. And then just before COVID, we decided, we just want to hang our shingles out again because we were already a not-for-profit. Right. And we're going to, we're going to get credentialed. So we got credentialed up, Right. You know what I mean? So I'm a perinatal educator. Mm-hmm. My the sister that works with me, she's a childbirth educator. We got all these certifications because people expect you to have that, Mm-hmm. So we did that, got infant massage certification, the whole gamut. And then we were like, okay, let's try to get some funding now because our community needs us. Yes. And so we just jumped back into what we were doing. So yeah, you get doula certification, but we consider ourselves birthing assistants. Okay. There's a difference. Okay. And then I don't want to throw shade on anyone who is working in the hospital as a doula, but I think community needs to be able to recognize that there's a difference. Because if you're getting paid for the institution, right, then you're going to look at birth another way. Because that's the hand that feeds you, rightfully so. So that's why I'm saying I'm not throwing shade. But some of the interventions, you're still going to go along with those. You're going to be okay with inducement. You're going to be okay with, Pitocin. Right. You're going to be okay with epidurals. You know what I mean? Right. Not that I'm not, but if you're having a baby, your body was made for that. And there are emergencies. I mean, hospitals are needed, doctors are needed. Right. For sure. But it's how you approach birth that makes a difference, right? Yeah. And so as a birthing assistant, you've had quite a bit of experience. I think that, clearly home births, we've done over 100 plus, right? And then hospital births, a lot of my colleagues don't want to go in the hospital because of everything that they see. But, if you have a good hospital staff and you have an excellent birthing plan and you have someone in there, doula, birthing assistant, that's supporting you and advocating for you, then, you'll have a better outcome. If not, because quite frankly, you in the hospital having a baby, you're not trying to figure out,
That's what Imani was saying. So that's it's so much going on.
My experience, my doctor, he was not there, and this has been I've been with him since I was 13. Okay. So he wasn't there, and so they were saying that my baby was measuring, her head was measuring 39 weeks, her arm was 37. So I was going every day to get every week to get an ultrasound. So they said, you know what? Well, was like, we need to induce. I'm like, induce?
And how many weeks were you?
39.
Mm-hmm. That's common. You know that's common, right?
No, that's
common.
So I'm like, what? No. And so everything was fine, up until, whatever measurements. I'm like, well, how was I feel like this is like all of a sudden. So I went in and I'm like, well, my doctor wasn't there. I said, well, does he know you're trying to induce me? Because, I didn't want any interventions. And so I'm like, so I went to the hospital. I said, well, they gave me my gown. I said, well, I want to talk to my doctor before you
rightfully so
touch me. Oh no, well he's on. I said, I wanted to talk to my doctor because I'm like, are you like? Right. I'm like, they're trying to induce me, and I'm like, because typically if you get one intervention, you're gonna follow up well. Yeah. So they end up. So I talked to him, and the new OB-GYN, she showed me the messages, we try to get you a natural birth, and I'm like, okay. So she was black also, so I'm thinking like, okay, but the staff around me was not. So they induced me Friday night. So laboring Friday, and I guess I wasn't progressing. So then induced me again.
They will keep giving you Pitocin.
So induced me again. So then I wasn't whatever. So and then it's like, well, now it's the balloon. Now it's like, and so so when they give me the balloon, I mean, so now I'm getting like all the interventions that I prayed not to have. Right, it's happening. It's on the pot. It's just, and now it's like, well, the epidural. I'm like, well, I really don't want an epidural. It's like, oh well, well, it's better to get it now because it's this and that, and I'm like delirious at this point. So now it's Sunday, about to be Sunday. So and I was telling him, I'm like, how can you really make the best decisions when you don't have no sleep, you laboring, ain't nobody here, ain't no, like my birth plan is shot to shit and ain't, I ain't got no damn birth plan at this point.
It's their birth plan.
Exactly. So, but now I'm just kind of like going along with shit that I know that I didn't want to go because now I'm just exhausted. Right. So when now they come in, lay your back, let me up, this and that, and again, now this is Sunday. I ain't had no sleep. She was there. I'm just like, I'm just like, I'm delirious at this point. So then when they come back in, I know they're not about to induce me again. I just start taking off my jewelry because at this point, I feel like I have no choice. And at this point, I feel like I can't Google not to have it. I'm just like crazy.
You in it?
Yeah, I'm in it. At this point, it's like now I'm like a cesarean. Yep. Like what? So I go in there
for you to say.
Yeah.
Now it's an emergency C-section. So they say it's not an emergency,
but now they want to get to it before it turns super severe. So then, look, I go in there. So now they start. Now I'm in the twilight zone. Yeah. I can't believe this is like it's like a nightmare. So then I feel them cutting me open. I told the anesthesiologist, like, he's like, oh no, it's just the medicine.
What? Dismissing your pain.
Exactly. I said, I'm like, okay, but I can't move. I can't, and I'm feeling like, okay, I hope I survive. You know what I'm saying? Like, I'm feeling, so then whatever he does, he gives me too much. I feel like I'm swallowing literally like golf balls. I can't breathe. I feel like I can't breathe. Yeah. I can't swallow. I'm like, I can't breathe. Right. And then everything was like super dismissed. So I'm like, damn, like I'm about to die. I'm like, I didn't think I was gonna be able to meet my daughter. I'm already claustrophobic, so I got this right here. I'm going crazy. I feel like I can't breathe. So I'm like, well,
no one has listened to you from point A.
Luckily, I was there to even make it like over. And then I'm like, wow. So what about all the women who, weren't able to make it? And so now that's kind of like been my drive.
Absolutely. As it should be. It should be. Because you go through those experiences and, you share them with others, but you do take up some sort of, initiative to make some changes. You have to, because your experience is real. And unfortunately, your experience is like countless other women who actually go through it. And what we're finding out is like there's still a lot of people who don't even understand or even realize that we are in a crisis with this maternal and infant mortality. We're in a crisis. Right. Were you able to go in with her?
No, I wasn't there for that.
You were sure. So let me say this. Did they break your water?
No, I don't.
At what point in time did they break your water?
They never said anything about breaking my water. They just, when they induced it, they said I wasn't like progressing with the and so that's when I'm just like I remember, I think it was the balloon that just like sent me to the top.
Tell me, what is the balloon? I haven't heard.
So what it is it's a cervical softener, and it opens your cervix up. And when your cervix is generally, it gets to about 5 centimeters, then you see the balloon, like it comes out. It looks like just like a regular balloon. It's medication for that. Now they also give Pitocin, through an IV, which all helps to stimulate and dilate your cervix. But understand this: the reason why after they give you the Pitocin is because those contractions start coming so heavy, so back to back, that you need an epidural. Because the pain is unbearable.
Because you can't recover.
Exactly. I mean, it's on now because you're having inducement is nothing but them causing contractions to happen, opposed to allowing the contractions to your uterus to contract on its own.
Right.
And so, what Imani is really pointing out is that it's an exhausting process, and it can actually slow labor down to the point where ultimately most inductions can end in a C-section. And so, what should be, ebb and flow, what should just happen becomes an emergency. And I say all the time, birth is not an emergency.
Right. So because when I was there for the birth of her first son, it was an amazing experience to be a part of that, because when it was time for her to push, I was like, oh, sad. And it's like, she's like, no, you can stay. I said, I can stay. And it was like such a beautiful thing to like see. And so like before she even got to the hospital, again, like her water broke in the car.
So you were able to labor at home?
Yeah, I labored at home for both kids. Okay. I have an 11-year-old and a 2-year-old.
Okay.
So with the 11-year-old, I was at home taking a shower when it happened. I felt something. And I was like, I called my mom, like, I think there's, something's wrong. She's like, girl, you're just in labor. So I needed,
so cool.
Yeah. And I was just like, okay, it was like a mild pain. But as soon as I got out the shower is when it kicked up. Like, really fast. Like real fast. And I stayed in the suburbs, and my doctor's office was downtown at Northwestern.
Okay.
So my parents came and picked me up. My fiance wasn't at home at the time, so they came pick me up. By the time we pulled up in front of the hospital, my water broke in the car.
Perfect.
Like everything was coming out.
Perfect.
So I go in, they got me in the room. I want to say Monty came, was there when I wheeled me in. And I want to say the labor was quick. I didn't have any issues, with my contractions were very quick, and they said, you're going to deliver in a couple hours.
Yeah.
They waited till the doctor came, pushed the baby out. Well, it was an issue though, with his shoulder got stuck.
So he had shoulder dystocia.
Yeah, okay. Yeah. And his shoulder was in there.
Yeah.
And I remember,
they were like,
it was like, but it went from normal to something's wrong real fast, because all of a sudden you just see nurses. Yeah. A whole bunch of them.
So you were 10 centimeters.
Yeah.
You were able to push, but because of shoulder dystocia, it did slow it down, because it should have been the head that was presenting.
So the shoulder is presenting before.
So it's the head, but the shoulder is like down into laying on the perineum most of the time. Yeah.
And so that was like an experience to see, because at that point it was them pushing my stomach. At that point, they're just
they were
like in it, like okay, like if I was like they're trying to revive me in a sense, like they were doing it on my stomach.
Right.
And then the baby came out. So that was
because the whole idea was to give it a push.
Yeah, give it a push to get him out.
Yeah.
Right. So I got that. Second pregnancy, same thing. I was in the house and I felt the pain, and I knew at that moment.
Yeah,
like,
you knew this time.
This is labor. I got to the hospital. I was 6.5 centimeters dilated already.
Great.
When I got there, they said, okay, baby's going to be coming soon.
Yep.
Before I knew it, the doctor was there. And I pushed maybe within an hour's time of me being there. I took a COVID test first. It was during COVID. After they did the COVID testing, they came in with the epidural. And boom, baby came within like an hour's time.
So you know what's really interesting is that if you were 6.5 centimeters and the baby came within an hour's time, you probably was a little bit further on than 6.5 centimeters. You know, which is
it was going up as we sat there. It was just like it was climbing up as we were there. It was 6.5, and then within like 30 minutes, it was like, okay, you're like at 9.
Yeah,
it was just really fast.
Yeah, so your body truly works well in labor. You were made to have a baby.
I'm so glad I just started recording because, like, I'm like, oh, let me just sit back and let this conversation happen.
Thank you, Jen, for coming. Like, this is like perfect. Yes. I've known all these ladies for like a long time, so I really
this is wonderful.
appreciate.
I appreciate y'all. Like, this is amazing. What were y'all talking about?
We were talking about my labor.
Yeah.
Oh, yeah.
So I was like,
quick
labor.
Yeah.
But no, that was it. The second one came out. You know, both of my children came out without me having to be induced or anything like that. I didn't have any labor issues. Both pregnancy, the birthing process was very quick, couple hours for each child. I didn't have any complications after either child. Nothing was wrong with the children. Like, so it was I was like on the good side of things. I didn't have any of those stories to say that someone.
You have gestational.
Oh yeah, I had gestational with my second child, my 2-year-old. Now that was upsetting because during that time I didn't know exactly. I saw it as if I had my first child, why didn't I have gestational with my first child?
Gestational diabetes?
Yes.
Okay. All right.
With my first, but then here I am in my 30s now. I'm being diagnosed with gestational diabetes. I did not understand that. I was just advised that my diet probably I'm older now, and but it came at a time where I was pregnant and my father just passed, so I don't know if it was stress from what was happening, but that was a lot. The gestational diabetes, I took that hard.
Yeah,
I took that really hard because then I had to change everything. I'm hungry, but I can't eat. I'm on a diet while pregnant. I'm having to exercise every single day. I was told to walk 30 minutes a day.
Which is
every
excellent.
day. Which was good.
So with gestational diabetes, it does happen. It's not uncommon for pregnant moms to have that as an issue, but it can be curbed with different type of diet. One that's low in sugar, one that's low in salt.
Sugar, yeah.
And and exercising plays a key part of it. And it's like when you have regular diabetes, it's the same thing. You want to watch your diet, you want to make sure you exercise, to bring down your levels. And most of the time, after you have the baby, then
it goes away. And it did.
That was a blessing.
Yeah, as soon as I pushed them out, they gave me a test and they said that I was fine. My sugar levels were back to normal. Yeah. So the walking really did help because I noticed when I took my sugars after I walked, my levels were very low.
Yeah. And so it works like that. It works like that if you have high blood pressure, if you have heart issues. Walking has a lot to do with it forces your body to work. And so working helped. It helped.
It did.
Yeah.
It really did. So I do recommend, and I was told by my OBGYN, she was advising me that a lot of people in the Black community don't understand that, the older we get, we can get case of diabetes, heart problems, and all we need to do, they said one key thing, she said, exercise.
That's it.
She said, if you walk 30 minutes a day, do you know the risk level of you catching that is now all the way down here? And that stuck out with me like to this day, because now I'll just work out 30 minutes on the treadmill every day, and I feel like my pressure might be down. I feel myself like when I don't exercise, I have headaches. I feel so and I'm like, it makes a very big difference. And a lot of people don't know that just 30 minutes, would honestly help out so much.
Or 40 minutes 3 times a day.
3 times a day.
Yeah. Or 40 minutes 3 times a week. As long as you're doing something.
Yeah. As long as you're doing something.
Yeah. It makes
yeah.
It makes a difference. Yeah, it does. And then I wanted to speak to your inducement, Imani. I just want to say that it's common for the medical profession to induce you at 39 weeks. In California, there is data now that's come out about maybe 2 years ago that actually shows that there's no benefit in inducing, and that there are complications as a result of it. Right. The issue is that by the time the whole medical community embraces it, a lot of time has passed before they actually will look at the data and say, oh, yeah. But in a sense, it's what they've known all along. I kind of like call it the God factor, where I'm going to decide what day and what time you actually have a baby, which, it takes spirit out of birth. And I think that it's important that we just advocate against it. And and it would have been, I wish you had known me, because I would have been in there saying, oh no, we're not doing that.
No, I didn't say this like for real, because I feel like that's kind of like trauma. Because the question is like, do you want to have another? I don't. First of all, I know that I would never have another baby in the hospital.
Yeah.
But that's if God say, I don't know, we have to have a conversation with God if you want me to have another child, but I would never have a baby in the hospital.
So let me say that I think it's somewhere, the stats are somewhere between 96 and 98% of births occur in the hospital. I work with the midwife, and we do nothing but home births. The difference between a hospital birth and a home birth, or even at a birthing center, it's like night and day. Mom gets to walk around but naked if she wants to, her t-shirts if she wants to. She gets to be with her mate, so as a birthing person, you're given that autonomy just to be in your own environment, and the environment the baby's ultimately going to be born in germs, right? So it looks so different, and just being able to have that knowledge that if something happens, you can be transported. Because like I said earlier, hospitals play their role, they have their place. But being at home is so peaceful, it's so stressless, and you can do whatever you want. You know what I mean? Yeah. So like today, like this morning, when I was at the hospital and had a beautiful baby boy. Mom was 36 weeks pregnant, so she was at the time of delivery, so she was definitely early, but the baby was 5 pounds 10 ounces, so maybe a preemie, but that's a strong baby that should be able to go home with mom, right? The other part of that was disturbing for me is it was as bright in here as it. I was like, okay, so we're going to like set the environment, and so me as a birthing person and an assistant in the hospital, I'm going to dim all these lights. We use like some nice oils to kind of set the tone, bring in some nice music, you know what I mean? Fans, whatever we need to kind of create that home environment. So mom really feels like, okay, I'm cool, I can do this. And then once your presence is in there, a lot of times things that would normally happen, they kind of like shy back because you're going to ask and you're going to advocate for mom. But one thing that was disturbing for me this morning was that apparently there was some papers she didn't get to sign. So she's breathing in labor. And they're asking her, can you sign these papers?
That is
and so I'm saying, can we get the father of the baby? He's here. Can he do it? Oh, we need mom to do it. So I was like, okay. So when you out the room, there, find the damn paper. Okay. We can move forward because this is ridiculous. You see what I'm saying?
That's what
and so the focus is not on the spiritual, part of birth. It's, you know what I mean?
Yes,
it's not on that. And even when it goes well, it's so sterile. It's not respected. Women and birthing people aren't respected to say, wow, she's in labor, let me let her breathe, let me let her relax, let me let her just be, the lights coming on, the blood pressure comes going off every 15 minutes, so it's a whole nother kind of, all of that is an intervention. People think that sometimes the intervention is just the medical intervention, but all of that is part of the intervention. You got my lights on, you asked me to sign some papers, you're moving all around, you're loud, you all are talking all over me. That's part of an intervention, opposed to me being able to just breathe and relax and like actually, like I tell my moms, you ride the wave. Having those contractions is like an ebb and flow. It's like a woman that's in the ocean, right? And they come and they go. But if you're able to like just get on top of that wave and focus and relax, you're good, you know. And so it's always best for moms to labor at home for as long as they possibly can. Because then, like in your case, right? I'm going up in here now. I don't have that much time to be because the baby's going.
Baby's coming. Yeah, you know, because I had another girlfriend. She did great for her first child. She went in. She didn't labor long, maybe like 5 hours. Amazing.
Yeah.
So her second child, typically, you know, you wait longer with your second child because you kind of know what to expect. And she was, her water broke, and she's like about to have the baby. So they get to the hospital. She didn't get to know the names of the nurses because the baby was like coming out like in the chair, and then she just got on the table. We're like, we don't even know your name, but, you know. But that's
it's like if you're able to labor at home, it makes it easier. And what I didn't hear you say was that you were able to like to get up and walk around, and that plays a big part in it.
I mean, it was just like, again, just everything that I prayed that would not happen. Because then I think they ended up giving me, like, I had a catheter. Like, I just
well, if you have epidural, you have to have a catheter because you can't feel anything from the waist down.
So right before, so once I did that, but the only thing I was doing, because I just feel like it was just like, I mean, it was just terrible. Like, but I use that as like a drive to like, you know, want to be able to help women like in this, to like just like never again, because it's a terrible experience.
And you know, a lot of moms who go through birth trauma, they really suffer from postpartum depression. Because the way the way you picture your birth is one thing. If you have like a not really, positive outcome, a lot of our moms go into postpartum depression because of that. And it's not because they're inadequate, it's because of all that, you had to go through, body, mind, spirit, for the baby to get here. So you feel like, oh, I'm inadequate, I did something wrong, I really wanted the natural birth. I was disappointed.
I was disappointed because I'm like, wow, okay, induced. Then it's like, another induced.
Yeah, like something was wrong with you.
Yeah, like, and then it's like, well, how did I get to 39 weeks and nothing was wrong? Now, y'all up here saying, and then I feel like, why didn't I know that? I should have known better. Then
you start doubting yourself.
It's like, what? So I had.
And then it's the fear factor. Like a lot of times it's unfortunate, but when you get in there, there's a fear factor. Like we tell our moms, we say, as soon as you think you're in labor, give us a call. Do not go immediately to the hospital. And there's something in us. Okay, I'm just going to say maybe it's indicative of this, remnants of slavery. But we have this mindset that they know better than we do when we get in there. And so, you will just submit, okay, all right, and they position themselves like, first of all, they're going to talk over your head, and they're going to say things you don't understand. And they really get you at a point in time, you've expressed it where you're like, okay, because I'm trying to have a baby, I'm having contractions, and some of the stuff you're saying, it's not even going in. And so, okay, all right, okay. And so that's how we find ourselves, like, in their mercy, because they put fear on you. And it shouldn't be like that, we should be able to have that support. And that's why a birthing assistant or doula is so important in those situations, because, they're going to say, whoa. I've had moms that I had talked to, get in the hospital. Last year, one of my moms, they, broke her amniotic sac, which is her water, at 3 centimeters.
Oh my God.
She wound up having a C-section. Because bacteria set in, infection set in. So when she and I really got a chance to talk, and I was like, so like, why do we do 3 centimeters? Because she called me, she's like, they just broke my water. And I'm like, well, I'm not going to get in tit for tat with anything right now, because my concern is you. Okay, so they broke on your water, so now you in the bed. Okay, now you're going to get epidural.
Right.
So when we got a chance to talk about it afterwards, because I always capture mom's birthday story, I said, so, what happened is she said, well, the doctor came in and when she said she was going to break my water, I said, well, should we break it so soon? And she was like, oh, it'll start labor. Not at 3 centimeters. You're not even in active labor, right? So why would you do that? So you have people to come in, and I'm trying to figure out, like, who are these people, right? And so at some point, when I do get there, they have her in the throne position. So the throne position is not you sit up, you're not laying in your back, but you're sitting up. The problem is that she couldn't lay on her left side, she couldn't lay on her right side, because after a while, there was no cushion for the baby. So the baby is literally laying on, and the babies can do that while they're in the water, but at this point, the baby really was laying on, her umbilical cord, the placenta cord, and the baby's in distress. In distress. And then they say, oh, we don't want you to have an emergency C-section, but it's inevitable because now she's got a fever. That fever and that bacteria is going to transfer to the baby. Wow. So, those are the things that I'm sorry, Black, indigenous people of color, especially Black women, endure more times than not. Last year I had a mom who they kept giving her Pitocin. They kept increasing it. They may decrease it a little bit, but they kept increasing it. Her uterus ruptured. By the time I got there, they had to give her 5 pints of blood, and she's 22. She could never have babies again.
Oh my goodness.
And when I was en route, and she was like, I feel a pain, and they were like, oh no, it's contraction. Her mom had to literally go chase the doctors down because at that point she was bleeding. She had to have medicine. I mean, I could give you more stories than not that should have, gone mom's way.
Right.
So
than had. So what do you say, like, for instance, so you've had like a situation like mine, nothing has been wrong. Then they said that she had NUGR or something, and that's why they decided to induce me. But if I didn't want to be induced, like what, like
so here we go. We can go against the grain of what's going on. And one of the things that I think I tell women, this is your work, this is your body. Right. And more times than not, you are not in danger. So if they tell you what the pros and cons are, of course you're gonna listen. You're not gonna do anything crazy and not have your baby or not be induced. Right. But I've had moms who at some of our hospitals here in Chicago, they want to induce, right, and they call them and they say, we got you scheduled for inducement. They say, okay, no problem. Mm-hmm. Right? Mm-hmm. Like, right. Okay, all right. They don't go in. Okay, we got you down for this inducement. We can reschedule it. She's like, okay, yeah, reschedule. I got some things going on. Deny it. Right. And as long as you're good and the baby is good, I mean, spirit runs everything. This is my belief. Spirit runs everything. I don't think you should put yourself in harm's way. Right. Clearly not. But spirit runs everything. And moms don't go in, and babies, occur naturally. There's things you can do. There's natural things you can do. You can eat like so many dates. Right. You know what I mean? You can do natural things.
So can't you like rub your nipples?
You can do that, stimulate the estrogen that's going to ultimately stimulate the contractions of your uterus. So there's things that you can do naturally.
No, but they scare you.
They scare you. And so you don't really have to submit. You understand what I'm saying? If the baby's fetal heart tones are fine, if you're fine, if you're not a high risk, a high risk mom, you can wait. I mean, it used to be 40 was the norm. And they will let you go to 42 weeks. Right. So norm is you can have your baby 2 weeks before the due date and 2 weeks after. That was like the norm. Mm-hmm. Right. And then, all of a sudden it was, you're 39 weeks, we're going to induce you. It happens more in our community than it does any other place. And like I said, it's the God syndrome, Man. And so we have all these really bad outcomes. And so part of my concern really is when we get into the hospital and we're like considered like doulas in the hospital, if we are working for the institution and we start going along with what's being done, then the other side is going to be, the story is going to be, oh, we have these people in the hospital and we're still having negative outcomes, you know.
Right.
So what happens with us? They have another scale how they determine, you know, who we are and how we function, opposed to the Caucasian woman, right? So if you have pain and no one's listening to your pain, you know, and they treat you, you know, differently, then you're going to have different outcomes. You know,
Right.
if a lot of times a mom's birth is slowed down, okay, mom, relax. You know, just, you know, you can get up, you can walk around, you know, drink you a little bit of this, you know, just calm down. We can wait. Mm-hmm. In our instance, oh no, there's got to be something intervention. We're going to give you some Pitocin. You know, we're going to figure out what we can do medically to speed your stuff up, opposed to, you know, our counterparts who, you know, they get time. You know, they have different stats for the reason why they'll give, you know, a black person a C-section opposed to why they'll give their counterpart a C-section. There's a whole different numbers that they go by. So, you know, we have to just keep, you know, pushing back, you know, and keep asking questions, you know. Yeah. And eventually, you know, our voices will be heard. The other part of it is that, you know, now in Illinois, you know, they did pass a law last year that said that doulas could get paid. So that means there'll be more private doulas, more community doulas. Mm-hmm. There'll be doulas in the hospital because you can get one now. But because, you know, they allow them to bill first, right? But the more people we have that's educated about birth, and we have to do a serious educational campaign in our community. We really do. Because a lot of our women who are having babies don't understand the need for education. So, you know, in our organization, Ba Nia Incorporated, we run an educational platform. So if you come to us, you have to take our childbirth education. You have to. You have to know what's going on with your body. You have to know the medical interventions, you know, that may occur and how we work through those things. So education really is important, you know. And even though we take our moms through that, again, we're so accustomed to submitting to the system that we still sometimes will find ourselves in those situations, even though we know better. So, you know, that's why we ask moms, as soon as you're in labor, call us. So we can come over there, work with you, be with you, and then determine when you should go into the hospital. You know, that helps tremendously. If you have moms or doulas or birthing assistants that are connected to the hospital, they can't come. There's a liability. But a community doula can. I will show up at your house, you know, put you in that shower, rub your back, walk around with you, and when it's time to go, boom, then we go. You know, and that makes a difference. You know, that makes a big difference.
I mean, it's saved lives. I mean, truly. And I mean, and the educational part is good because you should, like, mom should know, okay, if you hear this, like, okay, you kind of can prepare yourself or call your boo, you know, and say this is happening because you definitely need an advocate. I was, you know, telling her, like, you know, you can't, there's no way possible you can make the best decisions and off of no sleep and labor. And you think in labor. Oh, because exactly. I was signing, I was actually on this webinar with this young lady, and she was sharing her experience. She was in Maryland, and she said, because this whole cannabis thing, you know, rather like I guess at that particular hospital they test like the mom and so she said she was so she was literally like, she said she was crowning and they're making her sign this paper or this drug test, and she's literally crowning, but they're like, we have to sign it, and she was like,
no, I don't.
Oh. And then she, but I guess it's like the fear of not signing, and you know, you're gonna in the middle of like your crowning, and it's just like, That sucks.
Right.
Like had done that to a white
like
woman.
not even exactly.
Yeah.
Like how about not really liking your doctor and not really trusting your
Absolutely.
doctor? And so, a lot of times you won't say anything because you don't like this doctor, you don't trust this doctor, and you don't know what the doctor's going to do in terms of the outcome. And we've had, moms in that kind of situation where, they knew that they were not being treated fairly, but they were afraid that if they said something, then that would make their birth go another direction,
Yeah.
And that's I mean, we go through this whole thing where moms have a right. You have a right, and you can voice that opinion, And if there's someone in that room that you don't like, you can say, "Excuse me, I do not want you in here with me. I am not comfortable with you, and you need to go." And they have to go, but in that moment, you're not thinking like that. You just want to have this baby,
Get it over
with the best outcome possible, But when you're going through transition, you're 8 centimeters.
You're willing to do anything at that
Whatever they
point.
ask.
Like,
Whatever
because
they
at this
ask.
time, you just,
Whatever they ask.
you don't know if you coming or going, so if you feel like if you sign that paper, it's going to get you closer to the end goal, and then whether it means of going against of how you really feel, but in that but again, that comes to like, that's why you need the advocacy, right? And that's why you need be like, no girl, because I want to listen to my advocate. I'm like, no.
Like we say things like you have the birthing plan, and sometimes it's not the hospital, it's just the staff that's there, right? And so you say, like this morning, Dad, we doing skin to skin. So it's immediately the baby comes out, we're doing skin to skin, baby's on mom's chest, and they've shown studies where if the baby lays on mom's chest, the baby will root and find the breast, right?
Yes.
So we're doing skin to skin. Dad is cutting the cord. We're not going to cut the cord until it stops pulsating, and we're taking our placenta with us because we don't want it to be shampoo or hair, makeup or hair conditioner, or we don't want it to be lipstick or on somebody's face. So we're taking our placenta, and we're either going to throw it away if we can't do anything else, but you're not going to get it and turn it into a product, right? Or we're going to encapsulate it so that, we can have that as nourishment.
Right.
So, but someone in that room, like I said, we're taking the placenta.
Right.
Dad's cutting the cord.
Right.
Or we're doing skin to skin. Oh, okay.
Like where you're telling them what to do. They don't do
So that's what I do. That's exactly what I do.
To take your placenta.
But they can, by law, they cannot keep your placenta. So this is what they do. They say, well, you got something to put it on ice? Like you came in with a cooler. But that conversation you have up front. You go in and, before you even get in the hospital, you say to your doctor, I plan on keeping my placenta. What are the hospital regulations? Mm-hmm. Some hospitals will say, well, you have to have a cooler or something to put it in, or somebody there has to take it, out for you, right? So then when you get in there, you're prepared, and you say, several times, I'm keeping my placenta. I'm keeping my placenta. Right. And so by law, they can't keep it. They have to give it to you. It's yours. And the beauty of that, think about this. Think how bad women are, period. We're the only species who grow an organ. Yeah. There's no other species out here who actually grow an organ. As humans, we grow an organ. Like you're born with all your organs, right? But when you give birth, like that whole process of the growth and development in those 9 months, you actually grow an organ. That's your organ. You have the right to take it,
my placenta.
chop it up, bury it. You do whatever you want to do with it, but you can walk out that hospital with it, or whoever whoever you designate can walk out with the hospital. And we had a mom who had twins, and so my colleague that works with me, she was at that birth, and they were like, well, you have to have it, in the cooler. We just took that. It's winter in Chicago. We got cold for you. Right. Said, okay. We just took that placenta, and she, and mom put it in the car. Yeah. Boom. It's nice and cold now. And so we have a garden where we're like trying to do a placenta garden where moms can come and because sometimes you do want to bury it, and things grow. Things grow in abundance when Right. There's placenta there because it's an organ. it nurtured your baby for 9 months. You know what I mean?
Right.
It kept your baby alive. So it's yours to do whatever you want.
Do you all do placenta
Encapsulation? Mm-hmm.
Okay.
Yep, we sure do. We do that. And so it's excellent. I mean, it's excellent for the breast milk. It helps mom balance her hormones. You know, oh my God. It has so many, nutritional benefits.
Mm-hmm.
You just got 250 capsules by the time you're done with that, you good.
Right.
Yep.
Mm-hmm.
Yep. So they let you keep yours?
No, and it's almost, it's triggering to hear the stories and hear what's going on, because my birthing experience, I'm a first time mom, and when you're in the institution, they make you feel what they call a geriatric pregnancy for me, because of course when you give birth and it's at that 35 year mark and over, they made me feel like I was incapable of having a child. So with me, it was really unique, and of course, like a lot of women now, because it was during COVID. So my birthing experience, just off top, was different. I didn't get to have my tribe with me outside of just me and my spouse. And even then, because it was in the heart of COVID, he couldn't even come in with me to a lot of the visits. So I'm doing this stuff by myself, and I have my spouse, and we're just looking on FaceTime. So that kind of provided the trigger for me. On top of, and like, especially with the larger hospitals, it's like I'm seeing different faces each time that I go in. So I'm not building a relationship with anybody. So initially, in the beginning of my pregnancy, oh, well, your baby, she's looking a little small, and and I it's like, okay, well, mom and dad, we're smaller statured people. So again, let's give it some time. They wanted to do studies on me, and like, I think it was something where they wanted to put like this needle through my belly, and I'm like, absolutely not. I'm not having that. Yeah, it was something just like for testing.
What was the purpose?
It was something, I guess, when they were concerned, and I think I was
amniotic
fluid or something.
Yeah, I
and
saw
I'm like,
that.
no, I'm not gonna have that done.
Yeah, you don't need to have it done.
Right. So I'm just still very faithful person. I'm like, you know what? My baby is going to develop the way she's supposed to. I eat properly. I work out, do everything I'm supposed to do. So that was kind of disheartening, and of course it creates stress. So I'm like, you know what? Every day, and then towards like maybe 6 months in, oh, okay, well, she's on a higher scale, but she's still on the small side. Again, in the back of my mind, mom and dad are not, we're small in stature.
Right.
So, and every child is going to develop on their own accord. So moving with faith, we still go forward. And then I just noticed that when I'm meeting some of the physicians, I'm not having a good relationship with them.
Right.
I feel like a lot of them are just kind of looking at you as an item. Okay, well, no emotions are involved. It's very monotone, and I'm just like, I just need that emotional support, that reassurance. And I was not receiving that at all. So to be honest, my birthing experience was very scary. It was to this day I can still be emotional about it, because it's like my family wasn't there.
Yeah, I know.
I know.
But it was a lot.
You are triggered because it was not only was it a traumatic birth, it was a traumatic pregnancy.
Yeah, very much so. But God willing, like, everything was fine. My baby, and when you were saying term, I made it. They wanted to induce me at 37 weeks. So she was, when I delivered, I had the induction schedule. It was 10 hours of labor. That's including, just labor and active labor, 30 minutes in active labor. Came out, she was 5 pounds, 12 ounces.
Right.
So
it's still good, baby.
She was 4 ounces from 6 pounds. And 6 pounds is normal for girls. So that's great.
That baby
That was great.
So,
and how many weeks did you actually go?
So I went literally just to the 37th week. So once, and me not knowing, and there's a lot of things that I advocated for. I had my birthing plan written out, and it's basically like they just tossed it. They didn't need it, and
of course.
And again, we're heavily reliant on hospitals. So I'm just thinking, okay, well, this is how they operated. I wanted to go no drugs. I wanted natural, completely natural. And then of course your body tells you, I'm like, well, wow, I only have, and I waited as much as I can, and I'm like, the pain was unbearable.
You didn't have anyone there to help you breathe, work it out, relax.
Yes, so my spouse was
new
there.
For him too,
absolutely,
though,
but he was after he was awesome, we had I had brought my humidifier, I had my scented oils. I was trying to make it as
Create your
calm.
environment.
Correct. The dim lighting, all of that kind of made a difference. But I really wanted, I'm thinking, okay, well, the hospital has it set for this time, but I'm like, I don't really feel anything. They had to give me, of course, the Pitocin. That made me think about it, and I'm like, oh my goodness. And then of course I can feel the labor. But I'm like, my baby wasn't ready to come. This is just based off the hospital.
It's based off of what,
because they do that whole God syndrome. And it's a fear factor, know, and it pushes you into, oh wow, okay, I got to do something, and you all know what's happening best. But your spirit is saying, this is not right. This is not what I signed up for. Help me. But there's that support's not there. And hospitals have to stop looking at birthing assistants and doulas as family. We should be a part of the medical team, even though it's not, we provide non-medical support. We're not in there like actually doing stuff, not a midwife or but at the same time we serve a role and we shouldn't be counted. And see, that's how they block a lot of people out. And at some point during COVID, you could get in, you couldn't get in. And so even with your visits, the way you're saying it, like
I wasn't able.
There's no reason why, your mate couldn't be him, because you all from the same household. So whatever you have, he has. So what's the difference, right?
So it started to get a little funky, like the brunt, like the beginning portions of me, having to go to the visits, and then throughout the tail end, they wanted me to go every week. And because they considered me high risk. But it was actually like a month or two prior to those last. So because they were still considering my baby on the small end, so I had to keep going every week. And I'm like, this is daunting. But then I tried to look at it on the positive side. Well, okay, I'm getting extra care. I try to just to keep my mind positive, because the entire time I was afraid.
Right.
But then, and this was the part that really, really made me say, the next child I have, I will never go to the hospital. So, of course, they had me signing all the waivers, especially for the epidural, which I already had in my birthing plan. I said, I don't want to do it. But then the last 30 minutes, I was like, you know what? Anything, this baby got to go. So.
And they count on that. I mean, if they're giving you Pitocin, you going to get an epidural. They work hand in hand.
But isn't that counteractive though? Like, you're giving Pitocin to speed up the labor, but then the epidural kind of slows it down?
Well, it actually numbs you from the waist down.
Okay.
That you have to have a catheter, because then you have no bladder control, and then you're bedridden. So to me, that's when you're at the mercy of anything that can happen, because and so even with the epidurals, like, we do move our moms. So if your mate was on it, every 30 minutes or so, he could have put the peanut. It's like a little cute little peanut. They could have done the peanut for you.
I'm going to tell you about this. So with my epidural experience, it was so 45 minutes it actually took. So with the hospital that I'm in, it was like a lot of teachers. So they have like the new doctors coming, and you have your attending. So the anesthesiologist, brand new, came in. It took him about 45 minutes to put the epidural in place. I felt a lightning bolt pain shoot from the side of my left side of my body. And
I'm sure
the attending was looking, and I'm asking, I'm like, is everything okay back there? The entire time I had 3 contractions waiting for them to hurry up and make sure
that
everything.
And you're supposed to move.
Right, he can't move, so I'm balled up, crying, and then by the time that they actually put it in place, 30 minutes, the baby's here. But I was saying all that to say I wasn't even numb enough. So they rubbed like a piece of metal across my leg to say, to see if I felt anything. The right side of my body was numb. The left side, I can feel everything.
That happens a lot. Wow. It happens a lot where, and then a lot of times even afterwards, you have like some pain in those areas where you had received.
Correct.
Did you experience that?
I experienced that. So after delivery, maybe a couple of weeks in, I had to go to physical therapy. So I was in physical therapy for a few months. So I was literally out of work maybe about 10 months, 11 months, the entire year almost, before it was time for me to go back. And to this day, I still have, like, if it gets cold outside, I have some issues. On top of that, I really wanted my placenta. and I'm still upset that I don't have it. So just to hear you say that that is our right to have that,
Oh yes, you're right.
and me not being educated enough to know that or to like fight and advocate for it, it just I'm upset, you know.
Yeah.
So
well, let me say that lots of moms, birthing people get epidurals, and what you're describing, it happens. I have a mom. I was with her at one of the hospitals here, and it was the same thing. She could feel one side was numb, the other side was not. She was telling me she was in pain. They were coming in there to make adjustments, but the adjustments never occurred. And then, that's another thing. It's a sterile procedure, so no one is in there but you. Mm-hmm. And then the other thing, I think that we also need to point out is that, the epidural, if you're having a baby 30 minutes before the baby, if you're getting the epidural and your baby's coming in 30 minutes, one, did they really do it internally to see where you are? And two, you don't need an epidural 30 minutes before you get ready to have the baby.
It felt like I had a natural childbirth and I could have went without the epidural.
Yeah, all along. I literally could have. Because by the time they gave that, like I said, when I went in for the second child, I was 6.5 when I got to the hospital. So after doing the COVID testing, them doing, whatever they're doing, at that point, the baby is going to be coming shortly. Yeah. So when they did the epidural, I even thought, like, do I even need this? Because at this point, I'm like, I'm there. Like in a minute, I'm going to be pushing. And they gave it to me, and I felt everything.
Yeah. And the thing is everything. That, right. And see, the thing is that if they give it to you at the time when the baby's about to be born, it's not effective.
Not at all.
And then, it's just so unfortunate. But to me, it's a cost behind that epidural.
Absolutely.
So let's have that.
Even C-section.
So let's have that because there's a cost. And so that generates, a whole nother thing. And, we don't think about that. But they think about that. They're aware of that.
So they get money just to be able to give.
Yeah, and then one of the things I want to say too is that one of the things in our birthing plan is, do you want people in your room to observe? So I've had moms that say, you know what, I just want the medical team that's assigned to me. I don't want anybody in there observing, and I get that people need to learn.
But don't learn
on
me.
You don't always have to submit to that. You can say nope. I just want the people that's assigned to me. I know people need to, I know it's a teaching hospital, and people learn through, observation. But for this birth, for me right now,
absolutely not. No, somebody else to do.
And that takes from your experience too, because I had a lot of, even the day after, you're trying to learn how your child to latch on to you. I had a crowd of like the medical personnel,
the residents,
it's about 5 or 6 of them coming in early morning. I mean, my breasts are out, the babies. I'm like,
and you don't have to have that. You can say, I only want the birthing team that's assigned to me to be in the room. And that's usually about 3 people.
Right.
And that's it. And you don't have to, but the thing is that people don't know their rights. Right. And so that's one of the things that we push in our organization. We're like, this is what's going to happen. This is not going to happen. You need to know hospital procedures, and you need to know what you can and cannot do. And unfortunately, they prey on that. They know that you don't.
They bank on that. And then it's like the after, like trying to find your baby, like a good, like someone good to like see, and like Jen was saying, like who really cares about how you feel and what you're doing. Because like too, for me, like Mila was small, like they, like, oh, she's so tiny, oh, I'm like, okay, but she's healthy. Correct. And then it's like, oh, so then I had an issue with my milk, like I said, my milk wasn't coming in, so the lactation consultant, she was just, I feel like, just terrible, and she brought in this other lady, and she's just, let me see your milk. So she got my breast, and she's pushing it and pulling it, and I'm like, what? I'm just, at that point, it's that part too, and then the postpartum depression is there. It's like no one's asking me how I'm feeling, because the postpartum depression is already there, and so
postpartum blues,
and all that. So then as I'm taking my daughter to the doctor, oh, she's on like the smaller scale, and I'm like, oh well, hell, I'm a first time mom.
Are you able to breastfeed?
like for 6 months, and then because my milk ended up coming in, but so then people are telling me that like I don't have enough milk because then she's little, right? So I was doing, yeah. I guess I needed you. Right. So and it's like, oh, she's not eating
A
enough.
lot of our moms are so discouraged during breastfeeding. And it's really funny because remember they had the not funny, but that when they had the shortage on formula,
Yeah.
and I got like few phone calls, a lot of emails like, man, cousin, what are your moms doing? They breastfeeding. We don't have no worries over here with no daggone formula because my moms ain't on formula. You know what I mean?
Right.
And we're not making up no milk either.
Right.
Like how they used to do that too. But the thing is that they'll tell you that you don't have enough milk, and you start, you really start thinking like, okay, I can't do this. I need the formula. But it begins in the whole childhood education piece where you like, you know what? This colostrum my baby got, I'm share this with you. So, when we were, the underground, people.
I love it. I love it.
We used to use the colostrum, in the baby's eyes as a preventive, just like they use the erythromycin. They put the erythromycin in there. None of our babies ever got anything, because that colostrum is liquid gold. It is the immunization, it is the inoculation, it is the vaccine that every baby needs, right? And so when you that first comes in, that colostrum comes in, it's like there's nothing better than that in the world for your baby. And then what they don't say is, okay, for some moms, it may take 2 or 3 days for, the milk to fully come in. So what do you do in that time? There's teas that you can drink, right?
Yes.
So you can they have cookies that you can eat, there's things that you can do to actually increase your milk. We have everything we need right here, and there's a determination. How many boo-boo diapers is the baby having throughout the day? How many wet diapers does the baby have? Is the baby really on your nipple correctly? Are they sucking long enough? There's indications that show you, whether or not your milk is coming in and if it's sufficient, And most of the time, the majority of the time, 97% of the time, it is, It's just unfortunate that, again, to me, it's big business. To me, it is, their way of controlling, how we nurture our babies, like they know better than we do. Nestle came out with the first formula, right? And there were, if you do the historical background, because we do this whole thing on breastfeeding, a lot of us, I'm gonna go back to this because I'm Black unapologetically, but it goes back to, us as in slavery being nursemaids, right? We nurtured all these people that's running around here that have issues with us, and I'm like, so we were good enough to make all the Rockefellers and the J.P. Morgans and those people. We were able to nurture that family line to bring them to where they are, right? And our babies were dying of malnutrition because they used us as nursemaids up in the big house, right? Let's just speak it, right? And so it became such a negative for us as a community of birthing people, of Black women, to nurture, and breastfeed. A lot of us didn't because of shame. We don't know where that shame actually came from. But it's ingrained in us just based on our slavery experience. You see what I'm saying? And when sometimes babies come and they're preemies or whatever, if it's a Caucasian and she can't nurse, she gonna get some milk from a blood bank. From a milk bank. I'm sorry. But what milk bank do they tell, us about? They don't tell us about no milk bank. And so in our community, when we were actually underground and delivering babies, if we had a mom that had a problem, we had moms that would nurse those babies, and those moms didn't have no problem with it because they knew that was at least a Black woman that my baby is getting some nutrients from, and it's not a formula. Because formula is a synthetic food. When babies breastfeed, they have a factor where they come off that breath because they're full. When you formula feed your baby, which contributes a lot to obesity, the baby doesn't have that cutoff factor. That baby will suck that bottle for as long as you put that bottle in the mouth until the baby's so full. It's almost like the duck thing where the baby's like, okay, I can't take anymore.
Right.
But there's not that cutoff factor. Baby's nursing, there's that cutoff factor. So they don't really promote, lactation in our community. Right. And there's so many myths around it, like my breasts are going to sag. No, they're not. My baby's going to be so attached to me, no one else will keep my baby. No, that's not true. But hey, wait a minute. That baby's supposed to be attached to you because you're the mama, right? Mm-hmm. So, what's the negative in that? So there's all these like stereotypes that they put out there to discourage us from breastfeeding. And then when you look at like a lot of the pictures and stuff, they have white women. They don't have us black. They don't have us nursing. They have Caucasians actually nursing. So they've done a real job on our mindset and who we are about even having babies
because
and nursing.
See, the lactation consultant, when she came in, she's probably like batshit crazy or something. And I'm like, well, yeah, like I was going to start taking the tea. Oh no, you don't really want that because it tastes like licorice or something, and
what does that have to do with
and
it's good for me.
And it's like at that time, when a new mom, you're super vulnerable. Again, I'm just going like with everything, and then like my daughter, they said that she was tongue tied. So then it was like this specialty doctor from New York, and she came in. So I was like, my baby was like project. She's like, oh my God, this is like an amazing case of like tongue tied. It's like real like severe, and I'm like, well, again, you tell me that this is severe. Like, I don't want something to be severe for, with like my baby, and not like I'm hearing her, but I'm not hearing her. Like, I'm by myself. I'm tired. I'm like, okay, we have to cut. We have to snip her tongue, and so came in, like made this like appointment for my daughter because I'm like, it's tongue tied. I don't. Again, not really explaining anything and still like trying to nurse, because when my daughter came out, they said she ate the macronium.
Okay, she ate macronium in her stool.
So then immediately when she came out, like, I was out of it. Yeah. So I had the shakes like really, really bad. I couldn't even hold my daughter for a while. And then they immediately gave her formula, like in a little cup, like she was, drinking the formula out of a cup, and I'm just like, like, what y'all doing to my baby? Because I didn't
look. Her tummy, when babies come out, the tummy is about as big as a chair, right? Mm-hmm. So when they say the baby's not getting enough, her tummy is as big as a cherry, so the baby don't need that much. Yeah. So you don't, the little colostrum that comes out, that's enough for a minute. Right. That's enough.
They put her on me. That's enough. They give her formula and all here
without asking you anything.
I haven't even seen her because I'm just, first of all, glad that I'm alive because I thought I was going to die. Yeah. And so I'm like, I'm here sucking. I'm like.
And so she got some good sucking reflexes. She's drinking out of the cup. Let me tell you, third world countries, when they leave their babies, so first of all, we are spoiled in this country. We really are. There are no breast pumps. Sisters that are, third world countries, they actually express their milk, a lot of them, into a cup. Right. Because they don't have like the sterile, procedures we have, so they do that. And then they feed the baby through, like, when they leave the baby to go to work or whatever, the caretaker actually uses that milk and gives it to the baby through the mouth. And I was like amazed, like, dang, like, look at this, like that can actually happen, Mm-hmm. So for her to be like sucking in this cup like that young,
it was.
She had great sucking.
Yeah, my mom was like, oh my gosh, she drinks from the cup, and I'm here. I'm like, it was just formula, like But again, they're like, this and that. But
they could have gone to They could have gone to a breast milk bank, and they could have gotten some breast milk for you and given that to your baby.
And I definitely would have. I definitely would have opted for.
Absolutely, you would. Without even the question about it.
Yeah, or you're not even offered the option.
Yep.
How do you know to advocate for something that you don't? Exactly. You're not even presented. Yeah.
And it makes you frustrated, makes you angry.
Definitely so.
But it lets you know how limited they are as well. Mm-hmm. That they are like in this mode, in this box. And even I'd like to say that even some of the new doctors that come out that may have another mindset, I think that, once they start getting around the other folks who have like a certain way of doing things, they kind of like fall
They
right into
gravitate
that
right
as
into
well,
that.
and they become indoctrinated. But there are some, some good midwives out there. There's some decent OBGYNs out there, some decent nurses out there that really want to advocate, for moms to have births a certain way. Sometimes their voices are heard, sometimes they're not, but to have someone in there with you that can kind of like, say, well, no, we wanted this, we wanted that, what about this, what about that, and just question them, It's like when the mom I was telling you about that was had her amniotic sac broken so early. I remember I stepped out because I was getting so pissed off, and sometimes you don't want to be put out the hospital. So you have to like pick your battles. Right. And so I was talking to the nurse because she was cool. She was letting me like the throne position, like I've said, is the only position she really was comfortable in without a cord, like Right. When I got there, I said, listen, I'm like, so that they broke her water too soon. She was like, yeah. And I was like, like this is probably going to end up not going to.
But like, why if she knows? Yeah, like then why didn't she?
Because she's a nurse, and because she, it's like she's not going to say, well, they messed up, but she did say, yeah, I know. She said, and you're right. This is going to turn into a C-section. She acknowledged it because you have someone there, they know what's going on, but they're the nurse and not the doctor. Right. And then you have some nurses that are really into that status quo, like the sister whose uterus ruptured. Because I made her like after everything, I made her write it down because she had a lawsuit, right? So we were like making sure we took all the anecdotals while I was fresh in her mind, fresh in her mom's mind. And one of the things that she shared with me was one of the nurses came in and said, I don't play. You gonna have this baby, gonna turn this up. So you have people who advocate for the whole intervention, and then you have people that don't. I mean, you have some nurses really that are sympathetic, understand, have seen a lot of this. There's a few hospitals that I'm going to where, and this was during COVID. Right. Mom was in labor, that father of the baby was there, both grandmas was there, and I was there. 4 of us in there. And I've been to this hospital a few times, and they was like, "Yep, come on up in here." And just they had that midwives. It was cool, right? But there's and I had to look at my phone and share it, but there's a site where you can actually go and plug your doctor's name in, and they'll give you a grade, like the 1-star, 2-star, 3-star, 4 stars with comments. And so that's a good way to see, well, what, do I really want to be with this doctor? This doctor got like 2 stars. No, I got somebody else. And so you do have options, and then like we try to arm our moms with if they come back with some crazy stuff, we'd be like, okay, let's ask them this, let's ask them this, let's ask them this, let's ask them this. By the time we finish, and then like if I can't make it, call me, put me on the phone, because I'm gonna be on the phone while you asking these questions. So, hello, I'm here. This is who I am, and so we got these questions. So she asked, and then I'm saying like, whoa, slow down, because what you're saying, I don't understand what you're saying. So can you break it down in lay terms so we can get a real, understanding what you're talking about and what's going on. And sometimes they resent it, and then sometimes they don't have no choice to answer it anyway. But at the end of the day, they know that so you got people, like you were saying, your tribe wasn't there. They know you got people.
And they kind of gonna like back off a little bit. Carla, who did you have at your birth?
I am a nurse, but I don't know nothing about birthing babies. I do surgery and critical care. That's it. Okay. But I'm a first time mom. I had my baby like during COVID, but like the second leg of COVID. Who was there? It's my mom. His mom wasn't there, and my boyfriend. So we could only have 2 people. But I really, because I am a nurse, I advocated for myself. So a lot of the things that you all went through or you've seen, like I've heard about. And so going into like labor, I knew like what I wanted. I wanted an epidural. I'm not good with pain. So like immediately when the pain started kicking in, I advocated, give me the epidural. So it was in enough time where it was effective. I knew what I had to do as far as positioning to make it effective on both sides. So I was like, rotating in the bed. I felt nothing. I was in labor maybe like 12 hours. I got induced at 39 weeks. And that was for personal reasons because I wanted my daughter to be born on my father's birthday. My father passed when I was 15. So otherwise she would have been born on my birthday. And I was like, no, we can't share birthdays. But yeah, so I got induced that day and early that morning, and then she came that night. But I mean, my OBGYN, she amazing. Like, I don't know if she knows I'm a nurse, but we had conversations about, what you want to do. She was very thorough about, what she suggested that I do. I did have a stillborn 2 years prior to having my daughter, so she knew that. She made me go through like extra testing, stress tests to make sure the baby's heart rate could tolerate labor and everything. Everything was fine. My daughter was healthy. Like the pregnancy, I just don't like being pregnant, but the pregnancy was fine. I just suffered with severe nausea, vomiting the whole time, like the whole time. And yeah, she came like that night, and I didn't feel a thing, like with the epidural. I told them, don't let me rip. Like, she put pressure there, like,
Counter pressure on your perineum.
And I didn't rip too bad, like it was like a first degree or something, just a little.
Which is better.
Yeah.
To do that post episiotomy.
Yeah. So like, but I know it's because I'm on the other side, so I knew
I was just
what
about
to
to
do.
ask that.
Yeah.
Yeah.
So
And
it
I
goes into
knew-
that whole
yeah.
thing about
Right.
education. So
Right.
like, but most moms don't have that
Yeah.
benefit,
Yeah.
And then the other thing is that like working with your gynecologist, your OBGYN, I don't know if she didn't know, but I'm sure some of the conversation you had kind of maybe let her know that you were in tuned enough to, want certain things. And then let me ask you something. Were you considered high risk because you had a stillborn?
Yes.
Okay. Was anybody in here given low grade aspirin to protect you from getting
the baby aspirin
friend-
throughout the pregnancy? Yes.
So that seems to be a trend now too.
It is, because my friend, my very good friend, she's pregnant now. She's due in August, and she's 36, so she was like high risk because of her age. And then she went at one point, and they said her cervix was too short, so they tried to give her this thing but she's very like holistic like me, so she was like, I ain't about to put that up in me. Like it was like kind of like, remember Monistat, like something like you put in.
The balloon?
And
Was it the
no, it's like some cream, and she had to
yeah.
put it in her cervix. She was like, I'm not doing that. And then when she went back again, her cervix measured normal.
Yeah.
So she was like, was it just because it was the nurse who was there? Was she not being patient? Like now she's having anxiety because she suffers from anxiety. So she's like, well, why did she tell me my cervix was short? Or how come I'm going to another person and they said my cervix is fine or whatever? And then she was like, they told me to take this baby aspirin. I said, stop. I was like, don't take that. And I was like, don't take that.
So the thing is that the baby aspirin is a trend now to prevent preeclampsia, because in our community, we suffer a lot for preeclampsia because, I mean, there's a couple things that run through my mind, yes, I can see why we have high blood pressure. It's probably, part of our DNA, genetically, if you think about what we went through.
Yeah.
And not everyone's blood pressure, I think, in certain races are the same. Like, so what's normal for me may not be normal for a Hispanic or for a Caucasian, or, what I'm saying?
Right.
That's a possibility. I don't know. I'm not a scientist, but I think about those kind of things, where, oh my God, we all have high blood pressure. But this whole, aspirin thing, it's like this popping up, like over the past year, 2 years now, they want you to take, aspirin. I've had some moms submit to it and some moms who did not, and they were fine. The ones that didn't,
I never recall taking that.
Yeah.
Like,
So you
fine.
so you're OB/GYN, but it was and it was preeclampsia. See, it's for the whole preeclampsia, which really does damage your organs. But maybe it's because your doctor was like, cool, you don't need that. So it depends on who your physician is. You know what I mean? And then I mean, quite honestly, sometimes they look just like us, but they're so entrenched into the medical system that they function just like our counterparts would function. You know what I mean? So it's not always the color thing. It's more so like a medical mindset. But
that was the reason that you said that, because that's what I was looking. I wanted someone that looked like me to to kind of lead me and guide me in the right direction. And I took that advice simply because that's who it came from.
Yeah, but it's not always the case. Correct. And like you said, how you advocated for yourself. Like, I mean, we have moms. Let me tell you something. You want Pitocin? I'm good with that. But let's make sure that when we do it at the right levels. If you want an epidural, I'm good with that. You know what I mean? Like, we don't try to discourage your mom from having her birth however she wants her birth, because it's her birth, however she wants it to be, and so I think that's cool, but they gave it to you at the right time because you had already wanted it, you knew, and 12 hours is sort of like the norm for first time moms, anywhere from 12 to 24 hours, 48, no, not so much. I'm gonna tell you the story, as many babies as I've actually delivered, I had my baby at hospital, and it was a public hospital in New Orleans, and I was literally in labor, taking my own blood pressure, taking my own fetal heart tones, because hey, it was somebody there to do it with me. And I was fortunate because the brother who delivered my baby was my husband's diaper buddy. So, he grew up with him and his brother. And so my son was due on the 18th. I had him on the 18th, but I was in labor for 36 hours. And the brother who delivered him, his birthday was the day after. So it's really interesting. So, went through labor and I didn't, it was natural. And I remember the nurses saying, they would walk by me like, this one here, she is not on anything. And she's doing fine. And I was just on the breath. I was just, I had done yoga throughout my whole pregnancy, so I was like on it, right? And I had lost a couple children. So for me, this finally, having this baby was everything. And so, my son came out, and because we were in labor for so long, he had to be tested for everything in the world. So and during that time, the baby wasn't really in the room with you all the time. So they took him, and I said, listen, I'm breastfeeding, I need to have access. So they first brought him to me. And, I used to sing this one mantra throughout my whole pregnancy. I sang this one song. And so I was singing this song when I had him, and I put him on my breast, and, he was like, whoa, this must be mama. So I told him, I said, I want to breastfeed. When he's ready, bring him to me or let me come down there. Right. And I was like wondering, like, what is going on? My milk was filling up a little bit. And I'm like, what's going on? And then they called me, like, you got to come down here because he refuses to take the bottle.
That's not what I said.
So he was like, oh, I didn't smelt my mom.
Yeah.
Right. I didn't had the milk. Y'all, this ain't working. Right. I mean, so spirit to me, like I said, guides everything. So I'm breastfeeding him. And then because when your babies first come out, their jaws haven't fully developed. So they don't suck as long, right? So they'll suck and they'll get tired and they'll suck a little bit more. And so now, I'm like, well, I will, I'll stay down here. So then they tried to release us young. So I was like, okay, so we were released, but I came back like the same night, the breastfeed him. And I was like, I need to leave my milk. And they was like, what is wrong with you? They were tripping, Right. Like I said, he's 38, so that was a long time, right? So long story short, before, because I was like, okay, I'm taking him out. They were like, well, he needs to stay in for observation. No, he don't. He coming home with me. Something wrong. My husband like, well, we taking him. Period. He been here overnight without us.
Right.
So he coming home.
Okay.
So of course they made us sign papers to say, whatever, because we were taking him before they wanted to release him. But before they would allow us to go, they literally asked us to come into a room. It was similar like this. And there was nothing in there but doctors and nurses.
Oh my God.
And they wanted to know why we were so adamant about breastfeeding. Because from the time he was born,
oh my God,
I just kept him I was like, okay, I'm going down to the nursery. Y'all ain't bring him to me. So I just sat down there, and he would be tired. They were like, we'll change him. No, I'll change him.
Right.
I'll change him. I'll feed him. He's my
Right.
baby. I got this, right? And so before we left, they literally asked us all these questions like, why did you want to breastfeed? Because there were women in there with them who said they wanted to breastfeed, but they didn't let them breastfeed. They actually gave them the pills to dry up their milk.
oh my God.
And so I was like, because breastfeeding is the best food for them, and the way you all were, handling the situation, I had no choice but to be here, and now I'm getting ready to go home. But they really did want to know, because we were against the norm. You know what I mean? We didn't submit to the status quo. And when you don't submit to the status quo, I was like, okay, I wondered that like DCFS was going to knock on my door because they were going to say we took our baby and whatever, because they do that.
Yeah, I've been hearing more
There've been
about that, about those kidnapping.
Yeah.
Because
like you don't know best for your baby, but you do. And it's the same thing when you're in labor. You know best. You know what you want. You know what you want. And you should have that. And if you can't advocate for yourself, because like I always say, like when you're having a baby, you ain't trying to do that. You're trying to have a baby, right? They don't call it labor for nothing, right? So you should be focused on like the miracle of labor, And so having someone to advocate is really, really important. So I'm telling moms now, like if you don't have that person, then don't even go in there. Don't even go in there because you need to have someone to be there for you.
Because these hospitals really act like that big bully, like
Yeah.
they're bullies.
They do.
Yeah. And it's just like, and sometimes they'll bully you. Even sometimes you can just still be in, let's say, like the best state of mind,
right?
But still have them. Those are big bullies, because it's the institute.
It's a system.
And then until you have your ammo, okay, be like, no, no, I'm not speaking until I got my team.
Yeah, your team, your tribe, whatever. Because like this morning when I went in, and I was like, this hospital I always go to the emergency room, and there's a couple hospitals I go. Depending on the time the baby's born, I always hit the same team. Like, we know you, so it's cool. They know it's on and popping. We're gonna have a good time, right?
Right.
And so when I went in this morning, he called. He's like, well, the dad is up there and the sister's up there. I said, well, I'm her doula. Y'all gonna figure it out and let me up in here today. Right. So he got on the phone. He was like, well, she says she's the doula. And they were like, they let me up there. Y'all not gonna stop me from coming up there. Come on now. And then I said to them, well, wait, we can switch out when I get on the floor. Sister can come out. Because I'm going up in here.
Right.
And they let all three of us up here. It was cool. Because there's no reason why they should, stop you from having someone there that's going to give you support.
Yes, right.
And then they don't want to be in a newspaper.
That part.
At this point, that's what we got to do. Like, my doula came up and they would let her up. Let me get her on the news. Let's get this hospital on the news because we got to change
social media.
But that's the other thing that is changing in Illinois. Through the group that we're working with, they're getting ready to, some people from the state, they're actually talking to the hospital boards to say, birthing assistants, doulas, should be able to, be there and looked at as a medical team, so that, you can lend mom that support. And that, that'd be great for that to happen, for that to be, a policy, because a lot needs to happen on that policy level. And, I really do believe that the medical system is really too big to solve this. I believe that we as community, we have to solve this, and just work together and support each other, to make that happen.
I'm so grateful that you were here because I feel like you dropped so many nuggets and like, I might not even just take the time to edit this. Like, I just want to upload it so people can know and like see it. And it's just was so raw and needed in our community. Like,
we're releasing our certification program in June.
Okay.
So Ba Nia Incorporated will have a birthing assistant certification program. It falls under doula, but we're doing that. We're releasing in June. We're releasing in June. And we're gonna do some of it's online, some of it's in person. But we really could do the whole platform online, but we really want to do
the hands-on.
We want to do some hands-on. So some of it could be hands-on and some of it could be online. But yeah.
How long is it?
It's 6 weeks. But it's really a 12-week program that we're condensing into 6 weeks.
Okay.
So, people will be meeting like for 6 hours. We're looking at trying to break it down to like 2-3 hour sessions.
Yes.
But yeah, and it's culturally based. So, we're working with the Nguzo Saba framework where, it's going to be unapologetically Black. So we're really coming from that perspective.
Right.
Because I say, who can teach us better than we can teach ourselves, And so it's important that, we'll have some Ba Nia birthing assistants out here. We're excited. We're really excited about it. The thing is that, being a doula, you really didn't have to be certified, right? But it's good to be certified because people expect you to have some sort of credentials, right? So, my sister Aquila, who is my colleague, she's our director of operations. She has a PhD in education. So I always had to slow her down. Like, wait a minute, they don't need all of this. But so on some levels, we're on overkill because we want to make sure that we meet all the criteria that Illinois will be expecting, right? And all the criteria, period, in terms of what needs to be covered. And so, no, you are absolutely right. There's no way you're going to be able to learn everything in 2 or 3 days. And so we really want to make sure that in our program is extremely comprehensive, right? And that's like our format for our organization. It's like, so, you can go somewhere and you can get childbirth education. You can go somewhere and you can get, well, not that much infant massage. That's what, I'm certified in that as well. And you can go somewhere and you can get, pregnancy, prenatal, postpartum yoga. But we offer all those services and then some under one umbrella. So we keep mom from the time she's pregnant until after she has a baby. We have a really good, strong postpartum support program. Yeah. So like with you, we would have come over and let you get some sleep while you had had the baby. We do meal prep for you. We do like shopping, laundry, just for you and like the baby, right? And like if you have other children, so while the baby's sleeping, we keep the siblings, their siblings, keep them like cool down, so you can sleep and you can rest, And so we offer that, and then like referrals, like if you need mental health referrals, if you need housing referrals, if you need food referrals, because birth is not celebrated. You have a baby shower, but you're not celebrated to be the queen that you are. And 6 weeks, quite frankly, it's not enough time, even the mindset. In Illinois, it's a year, but what kind of support do you get within that year? You know what I mean? So, we really want to focus on mom and celebrate her to be the queen that, she is. She a baby birthing people are, right, so that, you can get back on your feet and feel good about, having given birth, and having that support. And quite frankly, whether you have, your mate, your mate may sometimes have to go back to work. Your mate is exhausted too. You know what I mean? So, us supporting you also supports him, and then, or her, whatever that may be. And so we want to make sure that, everyone in the family is supported. And that postpartum period is so important. Who says, it takes 1% of sight, 6 weeks to scab and heal, right? So who's to say, like, in that time, you shouldn't be lifting anything. You should just be chilling out, being the queen that you are. You've been giving birth. You should be able to, like, just chill and enjoy it, nurse your baby, nurture yourself, just eat the food that you want to eat, sleep in, you know what I mean? Get that remote control working, whatever it is that melts your butter, you should be able to have that. And be able to say, I need some carrots, I need some broccoli, I need some chicken.
And that's the biggest misconception to me, because it's like, women, we're supposed to be on our feet. I mean, I don't have any children yet, but what I'm seeing is that all my friends and people that I know of, I don't think there was a rest period where people were doing things from. It was just them on go. Them like, I know a friend, she had like a C-section, and her older daughter was still kind of needy. She was still clingy, and she's like lifting her toddler after a C-section, because the daughter's so attached to her, which is fine, but also too, like, girl, who else can take this baby? Right. Or who, stuff like that. So I think I'm a resource person. Like, let me tell you, if somebody else can do it, do it. Yeah. Because I just see so much burnout, even like from my mom and like from, everybody else in my family. Like, there's just so much burnout because there is no time to recoup from birth.
Right.
That is a big...
Because that's the expectation.
Yeah.
The expectation is you're going to bounce back, you're super mom. You even think yourself like that. Like, I can do this. Something's wrong with me if I can't do it. Which is why a lot of moms go into postpartum depression. Because they start feeling like inadequate because they feel like, well, dang, right now I don't want to do nothing. I love you, baby, but right now, and it's okay.
And you don't even know it sometimes. Exactly. I didn't know I was going through it. And of course you kind of shy away, especially if they have you sign those, have the questionnaires. Or of course not depression. Or you feel like you're gonna kill yourself.
And sometimes you're embarrassed to you don't want anybody to take your child. And those are the things that go through your mind. So I'm going in the appointments, and do you feel blue? Hell yeah, but I'm like, no, right? I'm like, well, yeah, but no. Right? Because they're going to use it against you. And so that's why, so there's like this lack of trust because there's not like a safe space, right? So, because I'm like, so if I tell y'all I'm really up in the head, are y'all gonna take my baby?
That's right.
Because I can't be honest, and I'm not gonna be honest. And you just go home and you just deal with it, and you just again, it's like you really need that village, that support. Like, what, go to sleep. Give me a baby. And so many times we don't have that, right? Because we just all go. We were just talking about, it was just so nice to like take a long shower, because a lot of times whenever you get because I have postpartum, so I'm like, man, when's the last time I took a shower, brush my teeth? I'm like, I'm out here trifling. So then now, I take my baby in there with me. Like I said, she acted like somebody was killing me with the water running, and I'm like, okay, you just the water just hits you real quick, but like. My dad's like, go take a shower. I'm taking like 30, 45 minutes showers, just
to have some me time. Just to have some me time. And you deserve that, and not just like haphazardly. It should be something that you get for a period of time.
And don't feel guilty about it.
I was not guilty.
Sets in like, oh man,
well, you should want to be with your baby.
I'm having that time.
You should want them. I love my baby, but.
So immediately after mom has her baby, we do our 24-hour check-in. We do a 72-hour check-in, and then we get in there, and then we do an assessment. How you feeling? And we've had moms say, "Look, I'm depressed." It's okay. We'll get you some. We have some resources where they have sisters they can go to that provide mental health services for free. And it could be in person or it could be online. And and then from there it's like, okay, but before then we already have gone through the piece about what do you think you need and who is your circle, right? Because sometimes you have a circle and your circle doesn't even know what to do because you don't know what you need them to do. And so sometimes we reach out to that circle and say, look, we're gonna need you to do shopping, we need you to do this, we need you to do that. And your people come up. They be like, okay, I got you. And when you don't have that, then we serve as that. And then we work with your circle too, because you need to have that kind of support. I mean, far too many times, our women, when people talk about reproductive justice, birth justice, for me and our organization, it's fair pay. It's not being exposed to domestic violence. It's having the right to choose. I mean, it's a lot of things. It's not just, well, I want to have this baby. Maybe you don't want to have a baby. You know what I mean? So it's a lot. And then we as women, we have this S on our chest. It is there, and we need to take it off. Not that we need to be vulnerable, but we need to say, you know what? Like you're saying, I'm a resource person. Let me find some support that's out here, you know. And if I don't know, let me ask somebody else that may know, you know. And just keep that community going, you know, and then create like even an extension of the tribe, you know. Yeah.
If I would have known this information prior to having my children, because I'm not going to have any more kids, but if I hadn't had this information prior, I really needed this type of support for my second child.
Yeah.
That second one that I had, it was just a really rough time in my life, and that support during and after would have been, I think that would have been game changing. Because I was at I lost my mind. You know, due to just stress. There was a lot going on during that time. And COVID, COVID, it was the heart of COVID that year.
Yeah.
And no one can come in with me. It was just me and Dad. And I felt that even though Dad was there, I needed more support.
Yeah.
You know, a woman's support.
Yeah. Exactly.
You know, like,
exactly.
man, you know, they
Exactly.
doing
They're
that.
there, but
Like,
like, they don't know.
Right. It was just, honestly, it wasn't even like useful.
Right.
I need the
But
motherly
this is
love.
new for them as it is for you.
It is.
So that
It
they
is.
need that
It is.
support
Yeah.
too.
Like, you know, it's funny this morning when I got there, brother was rubbing, mom's back, and I came in. He was like, "Oh, a couple things happened. He wanted to be relieved."
Yeah.
So when I first said,
I was like, the savior is
I said,
here.
well, no, I don't want to take over. You know what I mean?
Right.
We all got this rhythm. And he was like, no, I'm okay. I was like, okay, cool. So he let him run for a minute. I was like, okay, I got you. And he was like, okay, and he was happy to have someone there to support him because a lot of times they don't know what to do.
Right.
And it's okay, so like my thing sometimes is always to engage them because I don't want to step in, to what's going on between the two of you. It's working. It's good,
Right.
And then a lot of times, moms feel like, look, bro, you got me into this. This is both of us.
Right,
This ain't just me,
Yeah.
And so I always make sure that I find a place for him too. But a lot of times, I'm gonna tell you, brothers be like,
They just get back.
look, we done had a couple births where okay, I have to tell this. I got 1,000 more stories, but last year the sister, the brother, she was getting an epidural, and he had called me like, all right, is on. I'm like, I'm coming, I'm flying down the highway, So I get there, he's still in the waiting room. I'm like, well, he was like, I was waiting for you to get here, I'm like, okay, so we go in there together,
Right.
He's out.
We the dream team.
We going there together, he's the nurse.
He felt okay because you were there. Yeah.
So he's in there, he's talking to her. They having good conversation, and she's having contractions. He's talking. I'm saying, she really need to be, focused. But he's like talking to her. He's all geeked up and everything. And so I go over there. I set the mood. We get the lights. We get all aromatherapy going. The music is going and everything. He's all right. I look up. He on the couch. Like at some point he was like, okay, they got this.
Right.
He's knocked out. So now it's like, okay, bro, we getting ready to like push. It's like 10 centimeters. She's starting to push. I'm like, hey, wake up.
Right.
He get over there. He's on now. Yeah. He's like, yeah, push, baby. Oh, he was waking up. He was hilarious. I'm like, I should throw the shoe at you. He gets up. He gets all excited, and then the baby, comes out, and then he's calling everybody. Yeah, we did it. I loved it. Because he was comfortable where he was.
Yeah.
And he knew his mate was good.
Yeah.
So he could be good.
Right.
Yeah.
And then that she could be. Sometimes that's enough for the man.
Like don't pull me
pressure on them.
Sometimes they don't even want to
Yeah.
come,
Right.
but they gonna support their mate, And like so with a home birth, oh man, a lot of times traditionally, the brother's role was to keep away any negative energy that may be around his mate, around his household. Traditionally, they would do that. They would play drums, they would burn incense. And a lot of times in the home births, that's what brothers do. They burn incense, they get in the water boiling, they boil the herb for the sixth bath, for the vagina afterwards. Like they have a role in that home birth piece, and they're comfortable with that, And I tell this story that traditionally there's a tribe in South Africa, that when the brothers wouldn't be in the birthing, compounds with the mom, but they would tie a string on the penis. And so whenever she had a contraction, mom would pull on that string. And so that would allow him to be like, oh, okay, this is happening. You know, I'm sure sometimes he was holding that thing. It showed that there was like this connection, but he wasn't in there. And she was like, oh, you see what I'm feeling?
Right. You gonna feel it too.
You know what I mean? Because how can you explain it? Brothers don't know. Right. So they do need to be included, but it should be what they're comfortable with as well.
Right.
So that they can really feel a part of it.
I think that's like amazing, and I think I'll like share this with my friends too. I think sometimes like with the birth, right, we see on TV, and I feel like women were conditioned to see like like all this screaming, right, like so we're conditioned as growing up and seeing like, whoa, like birth is gonna be painful, I'm gonna be screaming, I'm gonna be like slapping you, I'm gonna be, and then I'm like, but what if we weren't conditioned like to see that?
Exactly.
Right.
Because then, some moms, they
it's very like euphoric.
And the baby, like, so not everybody has to holler, but again, like, everybody's not trying to like take the pain, but we're conditioned to, in our minds growing up, like,
it's a panic
not
time.
saying that labor is not painful.
It's an emergency.
Right. And it's like, because we're conditioned to see, this is screaming and everybody's going, and it's like really chaotic, right? But it doesn't have to be like that.
Exactly.
And I feel like if I don't know how to switch the narrative, but like embrace it, like, what?
Through education.
That's what I was going to say. So like reading books, I think that's what helped me throughout the pregnancy. If you know what to expect, if you know what your body is doing, what it means to have a contraction, I think that kind of helps me in a sense to, okay, well, I know this is what my body's going through right now. But of course, physically, you're like, oh, well, it's still painful. Right? And then another part I think that helped me was actually watching. So I had the mirror, so I saw my baby coming out. So, and I was it's really, I can't put in, it was just the dopest experience I could have had. So with my, my spouse, he's holding my legs and I'm looking at, that just shows you your progress. So I'm like, okay, well, she's there, I'm crowning, she's coming out, and I'm looking, and it's the most beautiful experience. I'm like,
that's one of the questions on our birthing plan. Like, do you want, when the baby crowns, do you want to touch the baby's head? Do you want a mirror so you can watch the birth itself? That's one of the things on our birthing plan.
That's a beautiful thing.
Yeah. It is, just to be able to witness it.
Right.
Some moms are like, no, I don't want to touch your baby.
I would love to be a tea. I want a baby catch it too. Like, I love it. I know she's tired.
But like you said, just like if I had this information earlier, it would have made my experience just that much greater. I'm strongly considering that because we want more children. I'm hearing out like how
absolutely.
This is why I want, to exchange. I know like want some more babies. It's order to that, but I'm not there.
And to me, age is not even an issue because, we have a mom right now. She's 45, something like that. So it's not, yes, there are things that change. We move out of, one phase in our life to the other. Pre-menopause, post-menopause, menopause. But if God impregnated you at whatever age you got impregnated.
That's right.
I say God's plan is the only plan. Whatever that looks like, we just got to make that happen. Yeah, absolutely.
This is great. I mean,
this is amazing.
Thank you.
Thank you for the information.
So I'm May Cousin Alexander. I'm the executive director of Ba Nia Incorporated. We are a birth justice, reproductive justice organization on the south side of Chicago. And so I am a traditional midwife, birthing assistant with credentials as a perinatal educator, infant massage instructor, and it's all about Black women birthing people having safe births.
Yes. And Imani, tell us about the SuperHood Mamas. This is why we're here. You created the space for us to just come and talk. So tell us your mission about that.
Okay, so just briefly, because this is just, I want to hide from all this like great info. So the Superhood Mama was created because I just feel like I had like just a lack of support with my experience, just with everything. So I wanted to gather women, more like a community, right, of women, to talk about the empowerment of motherhood and maternal education and health. Because sometimes like they don't talk about certain shit that we need like to hear. And then like we hear about my experience and your experience, like, oh my God, we kind of went through some of the same things, and maybe some of the things that I've dealt with, just like, for example, like having, knowing that information about, just having that support and just being able to like to rest after the baby. Maybe it just wouldn't be like as traumatic, but just like more so like sharing stories. And I came up with the Superhood Mamas because my daughter always calls me like, "Oh, you're a superhero," and I'm like, "Oh, so like yeah," but she's the real superhero because like just real briefly, like my daughter is a stroke survivor. They misdiagnosed her with Kawasaki and did not have Kawasaki, and so she had a stroke. And because of the medicine, and then they was about to cut my baby head open and doing all this other stuff, she slept for 3 days and did not respond to anything. And then one day she woke up like, I want to go home. Wow. So I'm like, I feel like she's like the superhero. So it's like, we're, as a mother, like, we have all these different roles that we're doing. And, superhero still means like, still saying, you know what, no, I can't do it, but we still like get it done. But so we're superheroes and motherhood me. And it's just like those motherhood woes, the good, the bad, the shit that they don't talk about. Like, maybe if I would have known that, I mean, I love my baby, but just knowing the information, and knowing that it's out there, I think it makes motherhood like, okay, we'll crowd out, we're gonna get it done.
That's right.
But, and you have that community of women. So that's what I just want to, another resource. So and I thank these ladies for coming out and listening and sharing your experiences, and we use that, to make it better, to where they don't have to, everybody don't have to go through trauma,
Right.
Because it should not be, birth life should not be traumatic. It should not, it should not, like a Black woman having a baby you should not have all this fear, right, of not making it after birth, because shit ain't easy. You making a human for 10 months, and in the US it's a little scary. So it's true. So thank you.